I finished my plastic surgery training in 1991. So I've been through all the different types of implants. I would say 95% of the augmentations that I did and many of the reconstructions in my training were a technology called replicon implants. MEME were also another version of that, but they were a polyurethane coated, more anatomically shaped implant, the replicon. And then coming out of training, and into practice, that's about a year later was when silicone gel implants were removed from the market except for reconstructive procedures and mastopexies. So there have been many different iterations throughout the process here. I used more anatomic saline implants for about 10 years in my practice, and then have switched as new technologies come in and as I feel that there are better technologies. I've been through all the different companies. I was a McGann guy, Inamed guy, Allergan guy, Mentor guy, Sienter guy. I think that when you get a new iteration or a new technology, that doesn't really come into clinical practice unless it's had the research behind it, long-term studies having already been done. It's onerous to get FDA approval in the United States, and many of the newer implants that have come into our market in the last 15 plus years, they've been used around the world for many years, and then now we finally get them, and we're sitting here waiting. Okay, let's get them approved. I want to try this one. I want to try that one, and so I think that now that we have a new implant company, and I'll say it, Motiva is an amazing new technology. I think it's going to revolutionize breast augmentation. There are many different parts of that implant. I'm sure we'll get into that, but the technology is solid. They have 20 years of research behind what they've put into their implants. 14 years they've been in clinical use around the world, and they were just approved by the FDA for use in the U.S. just last fall. So this is exciting stuff for patients. Really exciting for the patients also that are maybe just boob curious. People are out there thinking, well, a boob job, they're just going to try to make huge breasts on me, and I don't want huge breasts. It makes ladies maybe look a little matronly. So I think that the newer technology with Motiva implants is really also set for the patients that just want a little bit of help. I think with the Motiva implant and some of the benefits of that implant, we can more predictably put them even in front of the muscle. And, I think it's interesting, in front of the muscle probably has less discomfort, probably allows people to get back to activities a little bit faster too. I work out at a gym with a trainer who's a all-natural professional bodybuilder, and a lot of those people are in my gym, and I've operated on a lot of those patients. And, going in front of the muscle, behind the muscle, it's still a discussion because they want to show their muscles, but they also want to look feminine if they're in a bikini class up on stage. And so I'm familiar with that, small part of the numbers of augmentation patients that I see. But, I think with the new Motiva implants, it's going to open a little more availability to doing these procedures, maybe more in front of the muscle. And then I think that, again, it hurts less, gets people back to the gym a little bit faster. If I've divided muscle fibers to go behind the muscle, that's still a great way to do it, no question. It's not that one is terribly better than the other, but I think just having more options also makes the final result for patients just that much better.
Motiva implants are available in your practice today.
Absolutely.
What do we do if we want to come in for a consultation and play with them ourselves?
Well, consultations are always free. So, but coming in, it doesn't cost anything. And again, for what we call the boob curious, I think patients that have been interested but just don't want to be too crazy big. The other word that I use is ballerina breast. People just want a small augmentation, and traditionally people maybe wanted that C or C+, and now they come in wanting Bs. So we could still do that with other technologies and smaller implants, but I think Motiva is really set for the future with regards to some of these maybe less is more augmentations. And so calling the office and talking to my patient care coordinator, we can get you in really quickly. The surgery is really quick as well. It takes an hour and 15 minutes maybe to do an augmentation. I think the one thing that sets us apart in our practice, I feel like I really do partner with patients through the entire surgical postoperative course. Everybody gets my personal cell phone number. They call me day or night, regardless. You and I talked about earlier that there are no dumb questions. So, I do this all day, every day, and patients do this preferably once in their life. So, I try to be there for them, through thick and thin, hopefully more thin than thick. So,
Okay, give us your Instagram handle and your website.
drleebdaniel.com. We have a couple of other sites, but that'll direct you. And then Instagram handle is pretty easy to remember, Best Plastic Surgeon. So
That's you?
that's me.
I finally found him.